everyone, I'm going to be talking to you about surgery for prolapse. Before we get too deep into this video, I want you to take a look at another video I posted where I'm standing in a pink tunnel. And that video is going to explain where the organs surrounding the bladder live and what happens during prolapse. So that's just a quick anatomy video. So please take a look at that first before we get too deep into this one. So first of all, with surgery for prolapse, it's very much dependent on the surgeon as to what they like to do, and it's also dependent on you based off of maybe prior surgeries you've had or medical problems you may have that make certain types of surgeries possible and certain surgeries not possible. So there's no wrong way of doing surgery. It just really depends on what you want to do and how you want it to be done. So first of all, you have vaginal surgery. Okay, this is surgery done completely through the vagina to help support the organs that are herniating or prolapsing down. Number two, you can do laparoscopic, which is surgery done through 5 incisions, small incisions on the belly and a camera, and the surgeon stands next to you to do the surgery. And then you have robotic, which is similarly 5 incisions and with a camera inside, but the surgeon is about a few feet away at a robot console operating the robot that's assisting with the surgery. So that's those are the 3 different ways that we do surgery. We also do surgery open, as it's called, where we make one big incision on the abdomen and just hands in your abdomen we're doing surgery. But this is not done as much anymore because of these other minimally invasive approaches. So first let's talk about vaginal surgery, okay? So vaginal surgery, if your uterus is coming down, okay, then we either do a hysterectomy, where we remove the uterus through your vagina, no cuts on your belly, or we suspend the uterus. Suspend the uterus if you do not want your uterus removed, or let's say it's really not coming down that much that it needs to be removed, then we just help it or support it up where it really should sit. So really either one is feasible, and it really depends on you. Then we can do a bladder lift, okay, which is called an anterior repair or a cystocele repair. Okay, and this is essentially trying to put the bladder back up into its place. So let's just say this is your vagina, and your bladder normally sits right above it like this, all right? But in prolapse, what happens instead is that your bladder, rather than sitting nicely above it, actually drops into the vagina. So now your vagina is being pushed downwards like this, and that's a bulge that may come out through the vagina, okay? So when we do a lift of the vagina, or a bladder lift, we're essentially making it flat and putting the bladder back up where it belongs, right? We could do the same if the rectum is coming down. So this is to tuck down the rectum. And this is called a posterior repair or a rectocele repair, okay? Same thing, let's take a picture here of the vagina, and this is your rectum that normally should be sitting right under it, okay? But instead, it pops up the floor of the vagina, pops up into the floor of the vagina, so that then your vagina is bulged upwards, and that bulge can come out. All right? So when we repair your vagina, we use stitches to flatten it out so that the rectum stays where it needs to be. So that's a posterior repair. If you have laparoscopic or robotic surgery for the uterus or the top of the vagina, you may still require one of these procedures, the bladder lift or the rectum tuck down, to be done through the vagina. So in one surgery, you'll have an abdominal, like a laparoscopic repair or robotic repair, and then the surgeon will go below to your vagina to fix up another part of the vagina that's prolapsing. Now I'm going to group laparoscopic and robotic together because inside what's happening is essentially the same. Same thing, you can have a hysterectomy with your uterus, okay? Or you can have a suspension of the uterus to ligaments in the lower abdomen that help keep it up, right? You can also have something called a sacrocolpopexy. Sacrocolpopexy is a procedure that utilizes mesh, okay, to help support the tippy top of the vagina. So let's just take a look here. Let's say that this is your backbone and this is your tailbone, okay? I know, not such a great picture, but along your tailbone is a ligament called the anterior ligament. And let's say this is your vagina now. The uterus has been removed and your vagina is left, and we need to support the tippy top of the vagina right here, okay? Because if we don't support this, it'll just fall down through the opening of your vagina. So we have to support this. A sacrocolpopexy utilizes a mesh that hugs the top of the vagina and then tacks it up to the ligament on the backbone, all right? It helps support that tippy top of the vagina. Again, you may require surgery through the vagina to help support the rectum or the bladder as well that may be bulging into the vagina. So this is a sacrocolpopexy. Now let's say you are not getting a sacrocolpopexy and instead we're trying to use your own tissue to support the tippy top of your vagina. I'm going to draw another picture here, and again, I'm no artist. So here is your abdomen, and this is your belly button, and then here is your butt, and the rest of your belly over here. Your head is going to be this way, okay, and your feet are going to be this way. So let's just take a look as if we had X-ray vision to look inside of your body. You have a vagina now. Okay, because the uterus is removed. Either it was removed a long time ago and you've got prolapse now, or the uterus was coming out and we just did a hysterectomy. What do we do to support the tippy top of the vagina if we're not using mesh for sacrocolpopexy? So there are two sets of ligaments that are really important. One is the uterosacral, that's located a little higher up in the lower part of the abdomen. Okay, higher up meaning higher from the vagina, but it's still in the lower part of the abdomen. Okay, these are uterosacral ligaments. Okay, the uterosacral ligament. And then you have another set of ligaments that's located closer to the butt muscle over here. That's called the sacrospinous ligament. Okay? So when we're not utilizing mesh, we use sutures to suspend or support the tippy top of the vagina to these ligaments. Okay? Literally, we take the suture and we put it through the vagina and then thread it through these ligaments like that, and it helps support it. And the sacrospinous, same thing, like that. All right? So depending on the way that your surgeon's doing surgery, or whether you had a hysterectomy a long time ago, different ligaments can be utilized to support that tippy top of the vagina so that that doesn't fall down, or if it's already falling, that we put it back up. Either way, both are equally effective in treating this problem. There's no difference between how or which ligament is utilized or used. They both work very well. So I hope this explains a little bit more about the types of surgeries that are done for prolapse. Again, it's really dependent on what you are a candidate for. So talk to your doctor or surgeon about it, and that way you guys can come to the best plan if you are a surgical candidate.